is the overall success rate of cataract surgery?
Oh my heavens, it's extremely successful. It's one of the most successful procedures you can do. Complications do occur. It depends how you define success. There are many ways to define success. In terms of having safe procedures, there's less than a 1% significant risk.
What do biometry measurements tell you about my eye? Do I really need them?
Yeah, you do. They're critically important. All the decision making is made from the ophthalmologist's perspective on the basis of those measurements. Measurements tell you what your astigmatism is like, not just the amount of it, but the nature of it. Is it regular or irregular? So it allows them to make good, solid decisions about what would be the best type of lens to implant in your eye.
How should I prepare on the day of surgery?
When you're preparing for cataract surgery, you need to discuss this with the ophthalmologist's office that you're working through. Different ophthalmologists will have a different idea what is appropriate for you. Generally speaking, you can have a light breakfast. You show up at the clinic on time, they'll give you a schedule. Make sure you're taking your drops. It's good to have a friend with you. Someone has to drive you home afterwards. And trust the process. Often they'll give you a little Ativan or a sedative of some sort, talk you through the procedure, and that's pretty much it.
What should I avoid on the day of my surgery?
After surgery, we ask you to have a quiet, restful day. That doesn't mean you can't go out for a walk, but most people are feeling somewhat sedated. They've usually had something to help them relax. It's a stressful event, and people underestimate how much that impacts them when they get after surgery. Usually have a nap that afternoon. Usually your vision will get a little bit worse before it gets better, and that's all normal as well. So have a quiet, restful day, a good night's sleep. Generally see the 24-hour follow-up to make sure things are going well.
I'm really nervous about eye surgery. Will it hurt?
Generally speaking, surgery does not hurt. It's a painless procedure. You may get a sense of pressure. You might get a sense of wetness or coolness on the eye from solutions in that. Occasionally you get minor stings in that, but the surgeon generally will warn you when those are going to occur, but generally they don't occur. It should be mostly painless. You should feel that you go through the process quickly and start to see well. Generally, once you get up off the bed, you're generally seeing quite well, actually.
Can I choose full anesthesia?
There can be people who are very anxious to the point where they don't feel they can stay still during the procedure. In that case, you may want to use a general anesthetic. Usually, general anesthetic is not available in an outpatient setting. It probably is available through the hospital, and you would generally have to be booked through the hospital facility to have that kind of care.
Will my vision be perfect after surgery?
No, never. Vision's never perfect after surgery, but it should be very, very functional, very, very good. It's important to have that conversation before surgery too, because sometimes expectations don't fit with reality, and the surgeon's job is to try and give you a good, sobering opinion about what to expect. And different people will have more complex circumstances, so the ability to obtain a good outcome may be jeopardized in that setting. Again, all of those pre-op measurements that we do should give you a very good idea of what the likely outcome is, and that should be reviewed carefully with the patient prior to proceeding to surgery.
Will cataract surgery improve my distance vision?
As a rule, yes. You may still require glasses if the surgeon's not using some of the more advanced technologies, and there's still a proportion of patients that will be dependent on glasses no matter how good the surgery's done because of other factors. But generally, we're trying to, at a minimum, get you spectacle-free at distance. And of course, with all the high-end lenses, the new presbyopic correcting lenses, we expect you actually to see well at intermediate and near vision as well in those settings.
I'm living with cataracts, but my surgery hasn't been scheduled yet. How can I make sure my cataracts don't get worse?
That's really hard for people because they will get worse. Generally, age-related cataract grows slowly, so it's a slow process. But certainly if there's long wait lists, or if the cataracts are very early with minimal symptoms, often you may have to wait some time before proceeding to surgery. Lifestyle factors probably don't have much impact once you have a cataract, although good health is always a positive in terms of your long-term health care.
Can I have my cataracts removed even if my doctor says they're not bad enough?
Your physician may feel that the cataracts are simply not large enough to warrant the risks associated with surgery. And they also may feel that you are still continuing to do quite well, so they'll let you wait for a while. Again, it's a conversation you need to have with your surgeon about what is the appropriate timing for you and for the surgeon. They'll balance your risks and your benefits and hopefully educate you about what your options are.